Today, I want to spend a bit of time sharing my perspectives on Alberta's Open for Summer plan. My team and I were fully engaged in the development of this plan. We looked closely at the evidence seen in other countries, including Hungary, Israel, the UK, and several US states, as well as other Canadian provinces that had announced their opening plans. I believe this plan is a prudent approach to reopening, with Stage 1 prioritizing the easing of low-risk outdoor activities and only proceeding to the next stage as thresholds are met and the 2-week window ends. This stage is much more cautious than what you see in our neighbouring provinces, BC and Saskatchewan, in their easing of Stage 1 because we have recently had higher cases. We also considered the fact that the public health measures that have been needed over the past year are unprecedented in our lived experience and that they come with significant public health impacts as well. We have used these measures to save lives and protect the healthcare system from being overwhelmed, but these interventions have never been taken lightly. It is my opinion that we need to be as mindful of recovering from the impacts that the last year has had on Albertans' mental health, well-being, and determinants of health, as we are of the direct impacts of COVID-19 infection. All of these considerations helped inform our team's recommendations to Cabinet. For example, it was our recommendation that the plan focus on the percentage of all Albertans 12 and over who have the vaccine, instead of just the percentage of adults with a first dose, as some other jurisdictions have done. Based on best available science, we recommended the threshold of 70% with at least one dose in this age group as the metric for the removal of most mandatory public health restrictions. This maximizes the protection that we will have before significant reopening takes place. It is important to remember that the 70% trigger is a public target that protects Albertans and is a goal that we can all help to achieve. Every Albertan can rally together to achieve this level. However, Alberta's plan has many other factors that underpin it. This includes overall community protection, including post-infection immunity, second dose vaccine uptake, and vaccine effectiveness. It also includes monitoring the spread of the virus in the province and our health system capacity. All of these are essential parts of safely reopening and keeping cases down so we can stay open for good. And they are all accounted for in Alberta's Open for Summer plan. My team will keep closely monitoring case levels and hospitalizations, including ICU admissions. If we start to see cases rising over an extended period of time, with impacts flowing into severe outcomes, the plan allows for any needed adjustments. I know that some Albertans are wondering why second doses are not specifically mentioned in the plan. We focused on first doses because that is the most immediate target that we need to reach. But let me be clear, second doses are essential and are an integral part of the plan. For this plan to work, we need as many Albertans as possible to get a first dose and then get a second as soon as they are eligible to do so. We are looking closely at our available supplies and shipments, and we expect to be in a position soon to shorten the wait time between first and second doses. We will outline how this rollout will occur as early as next week.
I'm pleased to report that we have 556,000 bookings right now over the next 28 days, and 433,000 of which are over the next 2 weeks. And that, if those folks show up, just those 433,000, we will increase by about 12% of our eligible population, the percentage of Albertans who are vaccinated. That means we'll reach the 70% threshold. But those folks need to show up, and we need to keep driving for ever higher numbers, for broader protection, and that also will allow us to begin transitioning back more quickly to protective second doses. So we are, at the very beginning of this, we said pretty much every day that we're all in this together. I think we kind of gave up on that because it started to sound a bit cliche, but the truth is we truly are all in this together. Sometimes I've heard people in the COVID debate. I did a Facebook Live session last night, and some people were saying that they're not getting vaccinated because they're young and healthy and they aren't concerned about being affected by COVID. I would respectfully submit to them that they're missing the point, because as long as they're not vaccinated, they stand a chance of becoming infected and then potentially of infecting others. We are truly, in a scientific, in an epidemiological, and in a social sense, we are truly all in this together.